Hello and welcome to Cancer Council ACT's Let's Chat Cancer mini podcast series. Last season we looked into nutrition and cancer, so if you haven't already, please check out those episodes. In the next few mini episodes, we're going to be looking into sex, intimacy and cancer. My name's Ash, and joining me for these episodes will be sex therapist Andreea Ardeleanu. So grateful to have you and welcome.
Good to be here, Ash.
So before we really jump into things, I need to ask, how does a social worker become interested in sexual health when working with people impacted by cancer?
Ash, I was asking this myself. How did I get here? And it's good to reflect on what and who paved the way. I have worked in oncology now for almost 2 decades, and as social workers, we learn to do this thing called psychosocial assessments. So while we want to know about the diagnosis and the treatment, we are equally aware of the impact these have on all aspects of someone's life. And you and I, and everyone who might be listening to this now, knows a cancer diagnosis ripples far and wide. So I find myself doing these assessments and hearing about the impact on body image and relationships. And as people were moving through treatment and towards more survivorship and recovery phase, the concerns in counseling were slightly changing. Maybe from how am I going to do this to how am I going to live the best life I can after treatment. Because ultimately, we all have hopes for a good life. And intimacy and sexual well-being are part of how we measure quality of life. And then I think it was around 2014, I went to an oncology social work conference in Sydney, and I heard this fabulous social worker from the States, Sage Bolton, and she did extensive workshops on intimacy, sex and cancer. And I remember thinking, this is a real thing that deserves work and focus, and reflecting on how validated I felt for that work. The work that I was doing with clients and some of the research that I had done in the previous years. And so I took myself to big school and I did my master's in sexual health counseling and kept doing the work that is there when cancer impacts on sexual well-being.
Now, sex and cancer, I imagine, is one of those topics that people can find a little bit challenging to discuss with their health professional. Is that something you found?
So as some of my clients would come in and openly talk about the changes in intimacy and changes in their body image and sexual function after diagnosis or treatment. Other people will come in and be a bit more reserved, and I guess it's my job to gently explore these areas. Now, I want to make it clear that as cancer impacts widely, it also impacts very differently on different people. So each person I meet has different concerns and experiences different impacts of their cancer on their sexual health. So it's important to be considerate of this and not make assumptions. You know, as I was preparing for this podcast, I just kind of flicked through some of the stats that I have seen over the years. And, you know, the figures are quite significant. With a cancer diagnosis, there's the stats, of course, depending on the cancer type and the treatment and age as well, but anything between 10 and 100% impact on sexual function and sexual well-being. And of those people impacted, around 78 to 85% believe that discussing their sexual concern with their oncologist is important, right? And then when we look at how satisfied people are with the information that they receive, only about 40 to 50%, depending what study you look at, but between 40 and 50% of people report receiving sufficient information from their clinician. The reason for this are multifaceted. There are time constraints, some other more pressing oncological priorities are presented to the review. People might not feel that there is enough privacy in the setting that they are seeing their oncologist in. And also, it is about the comfort level of the clinician as well to explore these issues with their clients. And people have 15 minutes, 30 minutes with their oncologist for these reviews. So a lot to cover in a short bit of time.
Definitely a lot to cover, and some really, really important areas to cover too. Look, you mentioned before about not making assumptions in this line of work. What sort of assumptions were you referring to?
So, Ash, we make lots of assumptions around, who can have sex in terms of age, when is too young, when is too old. We make assumption about what kind of sex people have, who they have sex with. We make assumptions around relationships, if you are married, therefore you have a good sex life and that you have full sexual function. Lots of people are sexual function, it's impacted. That has nothing to do with the cancer. Also, we make assumption around single people, and often will not have these discussions with them.
Yeah, it's clearly an area with lots of misunderstanding and so easy for it to get overlooked. Now, today was just setting the background, and next episode we're going to look more into the impacts cancer can have on sex and intimacy to help raise that awareness. Andreea, thank you for joining us and looking forward to sharing your wealth of knowledge with the public. We really hope that by listening to this upcoming series, everyone will feel that little bit more comfortable to talk to their current or future sexual partner or healthcare professional and understand the impact that cancer can have on their body. Thanks for listening, and bye for now.